This conference will now be recorded.
Welcome to Medi-Cal Managed Care Payment Options. This is Diane Mashinsky. I'm from MNT Reimbursement Specialists, Inc., and I have been a Medi-Cal managed care provider for many years. And Michelle, you want to introduce yourself?
Yes, I'm a private practice dietitian who has worked with various HMO plans and PPO plans with nutrition therapy and diabetes self-management training.
And this is our disclosure that you can see that basically it says that each facility has a responsibility when it comes to billing, and that MNT reimbursement specialists, this is for reference only from us, and it doesn't provide any legal, financial, or other professional advice, and that we recommend that you have close contact with your billing. Next slide, please. The objectives of this webinar is at the end of this, you'll be able to list 2 providers who can apply for a Medi-Cal managed care contract, identify 3 possible additional income streams, and list 3 challenges in billing Medi-Cal managed care. Medi-Cal managed care is basically healthcare delivery system organized to manage cost, utilization, and quality. It provides for the delivery of Medi-Cal health benefits and additional services through a contractual arrangement between Medi-Cal agencies. Managed care organizations, or MCOs, accept a set per member per month capitation payment for these services. The goal of Medi-Cal managed care is to decrease costs, better manage utilization of health services, and improve the health plan performance, have better health quality and outcomes. As you can see from looking at the pie chart, Medi-Cal and Medi-Cal managed care is the majority of the clients that are in California that have Medi-Cal. Only 16.5% have fee for service, and the rest is all managed care. Medi-Cal managed care and pregnancy. Eligible pregnant women are required to enroll in a Medi-Cal managed care health plan unless they opt to remain with their physician in fee for service throughout their pregnancy and postpartum period. Medi-Cal managed care must include at least the minimum benefits of fee-for-service Medi-Cal. Some counties have multiple choices among managed care plans. Plans may have additional benefits, such as transportation. Plans may select billing codes for services within their system, and they may contract with non-Medi-Cal providers to deliver services. The most important thing with Medi-Cal managed care from a billing standpoint is that the client may switch plans every 30 days. Most women in childbearing years will have a Medi-Cal managed care. Your county's Medi-Cal managed care plans you can find by looking at the website that's provided here. It's basically dhcs.ca.gov, and then you can look for managed care plans and find how many there are in your particular county. Enrollees select one of the plans within their county, and they're issued an additional card. They have a regular Medi-Cal hard Medi-Cal card, and also a managed care healthcare insurance card. So requirements to bill managed care, you first of all have to have a contract with the Medi-Cal managed plan. The client must be eligible on the date of service. You want to check eligibility every visit because they can change plans every 30 days. The procedure codes must be listed in your covered services in your contract, and a plan may require prior authorization for some services. Medi-Cal managed care providers can be primary care, obstetrics, hospitals, clinics, dentists, dental clinics, federally qualified health centers or rural health centers, multi-specialty groups, specialty physicians like endocrinologists, cardiologists, perinatologists, and orthos. They also have allied health, private practice, DPTs, OTRs, pharmacists, registered dietitian nutritionists, CDCES, which are diabetes specialists, licensed clinical social workers, marriage family therapists, etc. Additional billing opportunities. Diabetes prevention program, diabetes self-management training, education and support, medical nutrition therapy, and devices monitoring. You want to investigate the coverage with managed care plan. See if you have in your contract the diabetes prevention program or the diabetes self-management training program, DSMT. You want to identify the billing codes that the managed care will accept. And if it isn't covered, you want to inquire how to add these services to your contract and find out if it is prior authorization is needed. And if there is another provider who is contracted that you might refer to. You want to check coverage in your contract for medical nutrition therapy, identify billing codes. If it isn't covered, find out how to add these services to your contract and find out if you need prior authorization to provide this. And is the referral needed to another provider who is contracted? Remote patient monitoring or continuous glucose monitoring system, office or patient owned. Right now, the remote patient monitoring has some codes in the Medi-Cal fee schedule, but the continuous glucose monitoring system is not in the fee schedule at this time, but you need to check back. Check coverage in your contract. Identify the CPT codes or the HCPCS codes. If it isn't covered, find out how to add these services to your contract and find out is a referral needed to another provider who is contracted. The place of service. Check with billing to see how the contract reads for the following modes of delivery: telehealth and group. In the past, telehealth has had some modifiers that you need to use for billing. Eligibility for preconception counseling, type 1, type 2, prediabetes, previous gestational diabetes, and polycystic ovary syndrome, PCOS, and any other that would be at risk for diabetes. The goal for preconception counseling is planned pregnancy, have a normalized glucose for hemoglobin A1C and or time in range, minimize poor outcomes due to the early 0 to 12 weeks poor glucose control. Possible services at preconception and postpartum. For DPP or diabetes prevention program, those that would be eligible would be previous GDM, prediabetes, PCOS, and at risk for diabetes. For DSMT or diabetes self-management training, it would be type 1 and type 2. For MNT, which is medical nutrition therapy, type 1, type 2, previous GDM, pre-diabetes, and PCOS and risk for diabetes. And for the monitoring devices, it would be type 1 and type 2 diabetic. Possible services during pregnancy for DSMT or diabetes self-management training would be type 1, type 2, and gestational diabetes. For medical nutrition therapy, it's all of them. Type 1, type 2, GDM, prediabetes, PCOS, and risk for diabetes. And the monitoring devices during pregnancy would be type 1, type 2, and also gestational diabetes. The Diabetes Prevention Program. This program is an evidence-based lifestyle change program for those beneficiaries who meet specific eligibility criteria. It prevents or delays the onset of type 2 diabetes. It cuts the risk in half. It is 22 certified peer coaching sessions provided over 12 months. And a minimum of 5% weight loss qualifies for additional maintenance sessions to continue healthy lifestyle behaviors. The eligibility for DPP is the first 4. They must meet all of these criteria. They have to be 18 years of age and older. They have to be overweight, not diagnosed with type 1 or type 2, and not pregnant. So those 4, plus one of the following. Either they were diagnosed with prediabetes, or they had previously diagnosed with gestational diabetes, or they're at high risk results on the prediabetes risk test. Eligibility for DPP preconception and postpartum, a recap of this is not pregnant, 18 years or older, overweight, not type 1 or 2, and one of the following again. They had previous GDM, they're at high risk results on a diabetes risk test, or they were diagnosed with prediabetes. The goals of the diabetes prevention program is to delay or prevent the onset of type 2 diabetes, promote realistic lifestyle changes that will last after the pregnancy and the postpartum period, emphasize weight loss with exercise, healthy eating, and behavior modification. Requirements for DPP, the Diabetes Prevention Program, is that you must use the Center for Disease Control and Prevention, CDC approved curriculum. You have to obtain program recognition by CDC, and you have to have trained certified peer coaches by CDC approved organizations.
Diabetes self-management training, education, and support is another stream of income. The process of self-management training is the facilitation of the knowledge, skills, and the ability for people with diabetes to do self-care, as well as the activities that assist a person in implementing and sustaining the behaviors needed to manage their condition on an ongoing basis beyond and outside of the formal training. Centers for Medicare and Medicaid Services uses the term training, the T part of DSMT, when they were defining the reimbursable benefit DSMT. So when you're doing billing, that's usually the wording they will be using. The requirements for diabetes self-management training requires recognition with the American Diabetes Association or accreditation with the Association of Diabetes Care and Education Specialists, formerly AADE. The instructors must be at least one of the following: a registered dietitian nutritionist, a registered nurse, a pharmacist, or certified diabetes education specialist, or board certified in advanced diabetes management, BCADM. The recommendation, however, is to have a multidisciplinary team for success and to handle many of the problems that come up for training. Registered nurse, registered dietitian nutritionist, pharmacist, physical and/or occupational therapist, social worker, exercise physiologist, diabetes care and education specialist, community health worker, and others. The eligibility for diabetes self-management training programs: type 1 diabetes, type 2, and gestational diabetes. The goals of diabetes self-management: that involves educating and empowering people with diabetes to better manage and control their conditions, reducing costs in the form of ambulance services, emergency room visits, hospitalizations, and lowering the rate of acute and chronic complications, thereby reducing healthcare costs, and most importantly, improving quality of life. The best practice in Medi-Cal diabetes self-management training are to follow Medicare guidelines by either being recognized with the American Diabetes Association or accredited through the Association of Diabetes Care and Education Specialists through their DEEP program. The client must meet the eligibility, and you need to clarify your contract details with the managed care Medi-Cal program to find out if these codes, G0108 for individual visits and G0109 for group sessions, are in your contract. Medical nutrition therapy and diabetes self-management training might not be able to be provided on the same day. So as you're planning your programming or doing your billing, you are going to have to look at some long-range details to make sure that you are getting the funding back that you need. Medical nutrition therapy is the nutritional diagnostic therapy and counseling services for the purpose of disease management. It's furnished by a registered dietitian, nutritionist, or qualified nutrition professional. There's a specific application of the nutrition care process, and in clinical settings, it is focused on disease management. It involves in-depth individualization with a nutrition assessment and a duration and frequency of care using the nutrition care process to manage disease so that outcomes are maximized. It assists with the behavioral and lifestyle changes relative to each individual's nutrition problems and medical conditions or disease, and the individual plan developed with the client, so it's client-based, for personal and cultural preferences, health literacy and numeracy, stage of life, and access to healthful food choices are all included. The goals are to reduce the incidence of pregnancy complications when done during pregnancy, improve pregnancy outcomes, and provide adequate nutrition to ensure normal growth and development, attain and maintain optimal metabolic outcomes. The eligibility for medical nutrition therapy, type 1 diabetes, type 2, gestational diabetes, pre-diabetes, previous GDM, current pregnancy, hypertension, and other diagnoses with medical necessity. Remote patient monitoring. This is the use of electronic information communication technology that includes things like glucose, blood pressure, weight, EKGs, heart rate, and it's originating at the site where the patient is or their device that is transmitted to the healthcare provider at a different site for the use in the treatment and management of medical conditions. The eligibility from remote patient monitoring would be type 1 diabetes, type 2 diabetes, gestational diabetes, and others where also reasonable and necessary for the diagnosis and treatment of the patient's condition under their health plan. The goals of remote patient monitoring, it improves access to healthcare. This data availability improves quality of care and disease management. There's peace of mind and daily assurance, and it improves support, education, and feedback. It decreases hospitalizations, and it does reduce complications of pregnancy. The benefits for the provider and the managed care client, possibly for staff, they might be able to work remotely, which gives some flexibility. And then there's less time and transportation, so there's less challenge for the client. We know that time is important and transportation is a huge challenge in our population. The requirements for RPM, the client has a device that transmits electronically the physiological data, and the provider has retrieval devices or equipment that are HIPAA compliant to receive the data. Possible billing codes to include in managed care. Possible codes you're always looking to contact your billing contract specialist in your office or facility to review the managed care contract. It's the devil in the details. You've got to know what it says. Check the contract for range of procedure codes. Generally, it's not just 1 or 2 codes. They will have a range to tell you if those services are covered. The CPT codes are numeric, and the HCPCS codes may have a letter and numbers after it. And if the codes are not in the contract, you need to develop a plan to add them to the contract. The rationale for offering additional services, additional reimbursement to sustain your program, improved health outcomes, which helps also the quality of the managed care organization, and it increases client satisfaction. Those are measurable outcomes when they rate you as a provider. The benefits also of adding services, again, the managed care outcomes improve. The provider may receive additional reimbursement, which helps pay for the additional services, programs, and staffing. The provider's additional services also increase their marketing value. The client will receive a more comprehensive care plan, leading to better birth outcomes and reduced diabetes risk and complications. And you have happier campers. People are just much happier with the services. Definitely one of the big goals of this program is to talk about creating a communication system with your billing department. You need to identify who needs to meet with the billing staff. There needs to be a development of a quarterly written plan for communicating with billing and the providers, knowing about billing procedures, keeping up to training new staff, yearly updates and training of all staff, and consider doing in-services, using webinars or YouTube. The service providers use those billing codes to communicate what was done. If they don't know what are approved codes and are not distinguishable, they are giving the wrong information to the billers. So there's a two-way communication. Billing department monitors and adds codes to the super bill and the charge master. Those are detailed services and codes that are reimbursable with each health insurer. In Medi-Cal managed care billing, you must be a contracted provider with a plan to be able to bill. And you must use the codes that are specific to each plan contract. That's why reading the contract, knowing the details is so important. At the time of service, the client must be eligible with a managed care plan with whom you are contracted. I'm going to repeat that. We've mentioned it numerous times. Medi-Cal managed care allows people to change their health plan monthly. When you look at that, that means when they walk in, you need to know that the verification of eligibility is there. So you are billing the correct plan and that you know that you are contracted with the plan that they have. Possible billing codes to include in your managed care contract. For diabetes self-management training, the range is G0108 to G0109. And these codes we're just repeating to you, but these are resources for you that can be looked up in the code for the fee schedule for Medi-Cal. Diabetes Prevention Program, the DPP, G9873 to G9885. Medical nutrition therapy, the 97802 through 97804, and the remote personal monitoring. There's 99091, and then there's 99453 to 99458. When you're looking at managed care codes for the diabetes prevention code, there's a range of codes. And the reason why there's a range of code for all of these is because they will tell you specifics. The diabetes prevention program is probably one of the most specific programs that's out there that tells how many, if the person attended, if the person lost weight. So these codes and your charging needs to be exact. When you look at diabetes self-management training, there's a difference between the initial visit and it's time-based, that might be one-on-one, and then the group visits would be 2 or more in a group, and again, it's time-based, and there are yearly time limitations for these. When you look at medical nutrition therapy, the codes again are time-based. The initial assessment intervention individual face-to-face is measured by units, and the units are 15 minutes. So for an hour, that would be 4 units. For the reassessment intervention individual face-to-face, that would be a follow-up, would be 97803. And again, the units are done the same. For group, however, the increment is 30 minutes for a unit, and that's for 2 or more individuals. And again, there are annual time limitations for medical nutrition therapy units. For patient remote monitoring, the codes are different and have specificity. This code 99091 requires collection and interpretation of the data, digitally stored and transmitted by the member to the physician or the qualified health professional, and there's a minimum amount of data that needs to be transmitted in 30 days. If it's 29, if it's less time or less number of minutes, then they will not pay for it. CPT codes range 99453 through 54 and 57 through 58. The remote monitoring of physiological parameters. There's an initial setup and patient education on how to use the equipment. We all know nothing works well if you don't know how to use the equipment. Determining parameters, what would be the highs and lows that would either send bells and whistles or would notify the patient or would notify the provider, and how to use the monitoring, how to upload, and the interaction with the client during the month. So taking the data and being able to communicate with the client on what adjustments might be needed in exercise, nutrition, medications. So challenges of billing Medi-Cal managed care plans. Usually there's more than one managed care plan in each county. So you need to know that the client, which plan they have when they walk into your office that day. And you must verify that eligibility seriously every month because it does change. Managed care plans may use different codes than any of these suggested codes that might be in the Medi-Cal fee schedule because they are also an independent health plan and they use different codes for different services internally. Negotiating contract for additional service and programs is very important. If you don't ask, you may not get additional services. So make sure that you find out what is there and assign an employee to monitor the Medi-Cal managed care bulletins and their newsletters because things change. They do not always notify you other than through a general communication such as a bulletin. Assign a billing staffer to attend virtual training meetings of the managed cares so that they can ask questions and they also can get periodic updates. This has been a public health emergency the last 2.5 years. We have been so fortunate for the flexibility where things have been offered via telehealth with virtual services. They've relaxed face-to-face rules. And this time frame is 90 days. That's renewable through the Federal Secretary of Health and Human Services. When it's renewed, that means that we can continue following the flexibility. They will give us notice when it is ended, but you must pay attention, and this is posted online. And you also should get, your biller should have this information as well. Telehealth has been a boon for this period of time. The Department of Healthcare Services, Medi-Cal, posts guidance about telehealth flexibilities directly on their website. And that's dhcs.ca.gov. And that's the plethora of information there is so helpful. The federal flexibilities will expire at the end of the federally declared public health emergency. You need to know when the state flexibilities will end. Remember, this has allowed the client to be at home and the provider can be an approved location by their employer. That has made a huge difference in continuity of care during the last 2.5 years. We provided references, the URLs for each of the topics that we talked about. These are references you can scoot back to at the end of the program. And You will find that all the initials of all the things we talk about are here. We know that it's alphabet soup and they change. So be sure that your staff is aware of them. We also thank you. We know that this information, all the numbers, can be so confusing. It takes several go-rounds to be able to absorb this information. Do not expect, especially if you have no experience in billing or codes, to be able to absorb information the first time. And it takes a team. It takes your billing people. It takes your contracting people. It takes your providers. Communicate for successful pregnancies. We thank you for your time and attention today.
Thank you so much.